This is KTN News.
The deal was to be signed by the Nurses Union, the national government and the county governments, but the Salaries and Remuneration Commission rejected the deal. The Kenya National Union of Nurses, which boasts of some 26,000 members, has vowed to stay away from hospitals until their collective bargaining agreement is signed. But patients are bearing the brunt of this HR clash between nurses and their employer, with at least 8 deaths which could have been avoided already reported. And the script could also be duplicated as doctors are also threatening to call for another strike. Tonight, we bring together a roundtable of health stakeholders. Can we finally find a solution to this recurring problem? That's up next on the Roundtable with Asha Mwili.
Good evening, welcome to the Roundtable. Tonight we want to seek a solution to the stalemate between nurses and their employer. On the Roundtable tonight we have James Kamau, who is representing the patients. He is from the Kenya Treatment Access Movement. Welcome to the show.
Thank you.
Of course, from the nurses we have Halima Aidan, we've been seeing her on our screens, who is the branch secretary, Machakos County.
Yes.
From SRC, Salaries and Remuneration Commission, we have John Monyoncho, who is the Director of Research Policy Planning.
Thank you.
A really big title. Welcome to the Roundtable.
You didn't finish it.
I know. There are a number of words of other titles that I didn't read out there. And of course, from the Council of Governors, we have the Acting Director of Health, Mugambi Laibuta. Welcome so much to the Roundtable.
Thank you.
Can we just go straight to the point? What's happening? Was there a meeting today to try and end the stalemate?
No.
Because we hear there was supposed to be a meeting chaired by Kotu.
None that we are aware of. We didn't attend any meeting today ourselves on this issue. Yeah.
So, I mean, it's been 9 days. Have we just decided that this is not important to resolve? Or what is happening from your different camps?
Actually, the union.
As a union, we have been ready for talks since we started the strike. And we have made this very clear that we are ready for talks. We were called by the Cabinet Secretary Labour on Tuesday, where we explained where we were coming from and why we had resulted into an industrial action. And she promised to call for a meeting. She in fact invited us for a meeting the next day at 11, which we attended. But we stayed there at her office for 2 hours and there was no one to talk to us and we left.
So what do you mean? You went to the meeting and
yes,
no one else showed up?
Yes, no one showed up. We were not even informed that it was cancelled. We were just told that the minister was engaged in another meeting and they would call us. And since then, we're just waiting.
And the last time we heard from the Council of Governors, you said that this strike is illegal, in your view. Is that what we're going to hear? It's illegal and that's it?
Actually, basically, not at all, because as you realize, it's the Council of Governors that sought the indulgence of the Cabinet Secretary in charge of Labour to mediate this process, to form some conciliation process as per the Labour Relations Act. And our aim basically is to say the mediation, the negotiation process was not over. I mean, there's still room for the parties to sit down, like just we're sitting here around the table, and iron out these issues, because the major issue, to be honest, is the issue of funds. How do counties fund the CBA? And the position of the Council of Governors, and actually the Council of Governors is not even the employee is the individual county governments. Yes. And the individual county governments are indicating that the proposals, well, all of us, of course, wish to have better remuneration for healthcare workers. And this has been seen. The doctors got some allowances, the clinical officers and other health professionals, even the nurses indeed have been enjoying some allowances from their return to work formula. So this indication, and there's been good faith on both sides. The Nurses Union, the Council of Governors and representatives of the county government have been in discussion. And what we are saying is that let's continue this discussion, let's come to an amicable solution and have indications within the CBA that counties can say, yes, we can fund this, we have the resources, and it's sustainable to do this.
But Halima doesn't seem in agreement. I can see you shaking your head.
No, I'm not in agreement, because we started this journey in 2014 when we got our union registered through the courts, because the government of Kenya, for some reason, had denied nurses for a very long time to own a union. But thanks to the Constitution 2010, every worker was given a right to belong to a trade union. So when we got the union, we immediately embarked in the process of having a collective bargaining agreement with the employer, which we discussed for some time. And when it came to signing, we were told that we had not discussed it with the two levels of government, which we agreed.
Is that
and
now,
went back now.
Is that last year when you had to call off your strike?
Yes, because for us, we believed we had employees who were in national government, and we had a collective bargaining agreement that we had discussed with the national government. So we expected us to be devolved with that collective bargaining agreement. But the employer said, no, look here, we are not your employers. We also have other employers coming in after devolution. So when we went on strike in December, we called off that strike within a week. And in the calling off the strike, we had an agreement. And in the agreement, it was very clear that we had, of course, they gave us some allowance. It is true, I agree with him, they gave us some allowance. But in the agreement, there was a clear statement that read we were to have a collective bargaining agreement within 60 days. That was in December 16th. So in January, as usual, people went for Christmas and they forgot about nurses.
And who sat in that meeting? Because
we sat in the meeting with the stakeholders who involved CEC's health, chief officers, county public service board chairs as a larger committee. And in the first meeting, we raised our concerns. Where is SRC? Where is Treasury? We need to do this conclusively so that we don't have hitches ahead.
Mr. Monyancho, where was SRC?
Clearly, SRC does not negotiate with the unions. We negotiate with employers. So if the employers are keen and they're clear on what they would like to do with their employees, at that point, they can come and tell us we have a discussion with our employees, and therefore we'd like to discuss what is your advice concerning the issues that we are discussing. Thereafter, we advise the employer, and then they go and discuss with the employees. So we do not sit on a round table with the unions in issues of...
Which we were assured that SRC was not supposed to sit with us, but we had their blessings. So immediately the larger stakeholders decided the people who are employers of county employees are the county public service board chairs. So we sat down for 3 months with representatives of county public service boards. Each meeting we sat with them, there were minutes that were signed by both parties.
What you're talking about is the forum.
Yes.
It's not the actual boards. It's representatives from every county public service board.
The chairs of the county public service
So
boards.
they came into a forum.
Yes.
What they call a forum.
Yes.
It's not really an organization or an entity that is recognized constitutionally, is it, this forum?
No, it's not actually.
I think...
So why would you, just a minute, James, I'm trying to understand, why would you have this forum to be the body that actually negotiates salaries?
They're the employers. They're the employers, the county.
Actually, I realized that the county public service, actually, it's the county public service. The county public service boards are just part of the county public service, because the head of the county public service is the county secretary, and the head of those governments is the governors, and it is the governors that gave the chairman of the county public service board this mandate to negotiate.
I want to correct him kindly, Asha.
Yes.
It is not the governors that have given the county public service boards the mandate to negotiate. It is in the County Governments Act, Article Section 59, that gives the county public service board the mandate to be the employers of county employees and to discuss anything that has to do with terms, remunerations, terms and conditions of work. It is in an act. So it is not the governor who gives the county public service boards the role of discussing anything concerning terms of employment.
So when you
with
sat
employees.
with the chairpersons of these boards and you agreed, these are the figures, because we have a draft of that CBA. Where did they talk about where the money was coming from? Did the governors know where this money was coming from?
What happened with the county chairs that we were discussing with? It was a journey. It's not something that we just sat down a day or two and agreed. Our document had over 35 items, some monetary, some not monetary, and we had to forego some of those things, and we agreed on some allowances. And on those allowances that we agreed on, the chairman of the whole negotiating team, our side, there was a chairman who was working for us and also for the government to be in the middle. He was non-partisan. He did a very good write-up to SRC explaining our journey and why we had agreed with what we agreed on.
Did SRC receive that?
Yes, we received that information. I will explain later on the process.
Okay.
Yeah, so that at least we'll allow her to finish, so that we're able to be...
Go ahead.
So as far as we are concerned as a union, we followed procedure. In the agreement, we were supposed to do a collective bargaining agreement within 60 days. An agreement that we were supposed to do in 2014. Then 60 days elapsed on 2nd of March. We didn't have a document for signing. But on 17th of March, there was a document that was supposed to be signed. And we expected the CEO of COG to do a letter and talk to SRC and get a feedback from SRC to us on those monetary, where the money was coming from and all that. Was not our business.
Did the feedback come back?
There was no feedback. Along the way, several letters were written from COG. At one point, the Cabinet Secretary for Health was even invited for a signing ceremony of the same document, which never happened. Then another letter was written to the union to ask the union to forward the final draft CBA to prepare for signing. I remember in a meeting before, it was on 7th of March, where we had agreed that we have concluded the document and it was ready for signing. And myself, I raised to the chair and I asked him if it was possible. Nurses Worldwide celebrate Nurses Week climax on 12th of May. So we requested the government if we can have that signed on 11th for us to have a present for the nurses in this country. That never happened. So it was again pushed to 26th of May when we had a last meeting after we realized that teachers entering at a certificate level were placed at job B5 in the new grading structure for SRC. So we had requested for a final meeting to discuss about the...
So you wanted to renegotiate?
Yes, to renegotiate that issue of the grading structure. And we wrote to SRC. SRC wrote back to the union and said, discuss that with the employer. The letter is here, attached. We had a final meeting with the employer. We discussed, presented our proposals and our evidences as to why we needed the certificate nurse to enter at B5, because we felt we were disadvantaged in the previous proposal that was given to us.
So this is
and we
last
agreed
month.
last month on the 26th.
Right.
We agreed and had minutes and even set the date for signing to 2nd of March. Because by then, 2nd of June, by then the union had already written saying that our members were impatient and there was an industrial action that was supposed to commence.
So maybe Mr. Laibuta can tell us, where did we, where was the chain unlinked? What happened during all those negotiations from where you sit?
Actually, as you are aware, before actually any CBA can be signed, the Salaries and Remuneration Commission has to give a no objection letter. But for them to do that, the employer in the public service has to prove several things. One, that they indeed have those resources. And those resources can be gotten in two ways. One, through the allocation, the equitable allocation and split between national and county governments. Secondly, through raising of revenue by the counties themselves. So we did crunch the numbers because SRC was very clear. You need to tell us where is this money coming from. Just to give you some figures, to implement the CBA for nurses as is the draft, the negotiation draft, comes to around 40 billion for the 4 years, and this 40 billion, that's 10 billion per year. When you crunch the numbers further, it comes to 214 million per county per year.
Right.
And also remember...
But when you were negotiating with nurses, when the boards, the county public service boards, were the chairpersons were negotiating, had they crunched the numbers before they actually made the promise to nurses?
Of course, the number crunching is constant. I can give you an example of the doctors' negotiations and with the clinical officers. Proposals are made. I mean, the union gives a proposal. I mean, the proposals are there. But at the end of the day, before the draft, we can say this is the final draft, we have to get that go-ahead from SRC. And SRC is very clear, as I stated.
So SRC said you cannot afford it.
No, SRC, let's be clear. SRC, they're not the ones to say you cannot afford it.
Right.
It's for the employer. It's for the employer. It's for the
SRC wrote to them. SRC wrote to COG in a letter that we even have a copy and asked them to give them the evidences as to where they will get the funds to fund the CBA. So I'm not sure whether COG has written back to SRC to tell them where they will get the money.
I think what I can state is that, you see, this is a multi-stakeholder. The issue of money, there's National Treasury, there's the controller of budgets, there's the CRA.
Right.
And all these have to be involved. Let me give you another scenario. Currently, we have the Division of Revenue bill that has not been passed. Mm-hmm. And bear in mind that National Assembly and Senate are going on recess on the 15th. Mm-hmm. In those figures, and this is Thursday, the day after tomorrow, in these figures, the National Assembly had allocated 291 billion shillings to the county as equitable share. However, there are the allowances that have been given to nurses, doctors, and clinical officers that come to 12 billion. That Division of Revenue bill as is does not even cater for what the health workers have been enjoying for the last 6 months. So what we said is that let's recrunch these numbers. Let's talk to the relevant authorities. Let's be sure that this is what we really want.
So you want to go back to the negotiating table?
Actually, in our view, the negotiation is still ongoing. Mm-hmm. And it is for this reason that the Council of Governors sought the intervention of the Cabinet Secretary in charge of labor to say, we've reached at this point, we've been in these discussions, but we've reached an impasse because our partners in the negotiations are no longer on the negotiating table. And what we are stating is that just please come back to the negotiating table.
Right.
Let us look at this contentious issue, which is the issue of funds. And the issue of funds is about several items. One,
so I just want to just pause you right there, because I want us to get some perspective about the nurses' strike so far. So we are on day 9. Just 2 days after nurses went on strike, the effects were already being felt. And I want you to watch a specific story. There's a screen right there. I want you to watch what our reporter Francis Ontomwa was able to get from the Coast General Hospital last Monday.
The moment the call was made by the Kenya National Union of Nurses to begin the strike, the Coast Provincial General Hospital was affected almost immediately. Hospital administrators started to turn away new admissions as those already admitted were served with an exit notice. Patients, some in critical condition, left with reckless abandon.
Ninatibiwa kidonda cha mkono uliovunjika uwekwe chuma. Chuma tumenunua. Je, leo tuangojea tuwekwe chuma? Tunaambiwa kuna mgomo, sisi tutoke tuende zetu. Sasa tunauliza vitu tumenunua chuma, simeenda dieta tunaambiwa leo imefungwa, hakuna kazi yako, tutoke tuende zetu. Hata watu wa chakula wanatuambia wameambiwa waende sawa, wasilete chakula tena hapa.
Nitamsaidia vipi babangu? Serikali jamani, watu angalie, sisi ni watu hatujiwezi. Hatuna uwezo. Mamangu sasa nitamfanya nini? Nitamtoa pale nimpeleke wapi?
Inside the wards, it was utter confusion. Everything seemingly way off base.
Nimelipa pesa ya tieta, nimelipa pesa ya chuma, na bado sijahudumiwa mpaka sasa hivi.
A couple of hours after the strike began, at the CPGH entrance, it was mass exodus. Patients stranded, most of them not sure where to seek relief.
Leo kufika saa 5 nimepata habari kwamba wote waende nyumbani. Hakuna manases ambao wanafanya kazi. Na huyu mgonjwa pia bado hajakuwa vizuri. Nitakubeba tu kama mtoto mdogo niende naye nyumbani. Pesa ambao natakana ni 30,000. Hiyo pesa saa hii amekuja briefly, sina hata ndururu saa hii.
Kuna madango hapa tulikuja naye since Friday. Ilikuwa takana afanyiwe dialysis. Akona cervical cancer. But since then tulitoka kwa emergency, tukapelekwa kwa ward. Na hakuna kitu imefanyika. Madaktari wanakuja na muangalia, wanatuambia tungoje.
This lady tells me that she has a patient in the intensive care unit. All along, it has been a case of racing against time to save his life. The situation has now been compounded by the nurse's stalemate. Hospital authorities have given her a 6 p.m. notice to have a patient out. It's a nightmare.
Inaelekea mahali pabaya. Kwa nini watu wasijali uhai wa binadamu? To be realistic.
She's not alone. Even as the script begins to develop, confusion from both the national and county governments seem to deepen the plot.
Once SRC makes a pronouncement on the matter, county governments will go ahead, together with national government, will go ahead and sign a CBA with the nurses union.
It's really very surprising to us to see that the county governments cannot conclude CBAs. Yet we negotiated the salaries with the nurses, what was to be put there. But I understand that there are pressures to change those negotiated salaries to be higher.
The Kenya National Union of Nurses wants all its 45,000 members across the country to engage in the strike to push for the signing and implementation of the CBA. Patients may not understand the nitty-gritties. All they know, the government has let them down again, exposing them to suffering.
Okay, so the reason why I wanted to show you that story is because the ordinary Kenyan watching at home and hearing what we're discussing doesn't understand all these nitty-gritties. What they know is, I go to hospital, my patient is dying. Let me bring in Mr. Kamau, because you represent the patient here. What do you think when you're hearing what we're discussing so far?
Let me put it this way. They say when two bulls fight, the grass suffers. And the people who suffer are the patients. And the patients are suffering totally because the result of no treatment like what we have just seen is that, and they don't have money to go to private hospitals, they're going to end up going to chemists for treatment. Incidentally, we have very many chemists, both legally registered and others that are not registered. And we have been having problems of people getting medicine over the counter where the pharmacists treat the symptoms.
So you go to hospital, there are no nurses, your first choice is to self-medicate.
Chemist, self-medication, or online treatment. That's another thing that is now coming up, you know, where you're going out there and purchasing. So we end up now castrating the effect of the drugs or the disease burden.
But I mean, do you understand, where's the balance? Because we understand nurses have the right to hold industrial action. So where do you balance the patient's right and the nurse's right?
Nurses have the right. And I fully agree with them. Incidentally, let me explain this. We had the doctors and clinicians strike earlier, which took over 100 days. The effect or the catastrophe in terms of deaths was actually reduced because the nurses were out there. The 45,000 nurses were out there. Today, let me give you a very good example, especially of what Professor Ndwati, I will quote Professor Ndwati word for word in the paper today, who's a pediatrician, who said that the entire mother and child care in hospitals is run by nurses. The strike will erode all gains made in the mother-to-child transmission and dispensing essential drugs like ART to over 1,000 or 1 million patients all over the country. They are the ones with the bulk of the matter. They are the ones who do everything. And it's extremely important that we have. Right now we have, in 2002, we had a patient-nurse ratio of 1.2 to 1,000. In 2014, 2015, we have a ratio of 0.3. That is not even a full nurse in terms of the population. And the work burden within which they do and whatever it is.
So they're definitely, you know, they really should fight for their right.
They really should fight for their right. But other than fighting for their right, we need to understand what exactly are they contributing towards the economy or the, you know, the,
Right, yes.
you know, here we are running up the Sustainable Development Goals. We are now a middle-income country. You know, we are, you know, out there talking about all the development that has been done, which cannot be done without a healthy nation.
I understand you. So, I mean, Halima, maybe also you can react.
Yeah,
from the nurse's perspective, when you hear that the same patients you treat every single day are now...
It's unfortunate that this happened.
Yeah.
And it's unfortunate that the government of the day does not understand who a nurse is. It's very unfortunate. It's unfortunate that a government can decide if anything is given to a nurse, it should be given to every other public servant. A nurse is a person who is awake when everybody else is asleep. A nurse is a person who is taking care of people who are not able to take care of themselves in the wee hours of the night. When everyone comes on duty at 9 and leaves at 5, it is a nurse who remains with the patient. So as nurses in this country, we are not going to mince our words. We have suffered for a very, very long time, especially because of our numbers. But no one has ever thought of what a nurse does in that hospital. And we do a lot. It is not even something that we can explain here for anyone to understand.
So it's understandable. But Mr. Munyonsho, when you watched that story, what stood out for me was Governor Nanok saying that, you know, when SRC says this is what's final, it's what's final. So it actually makes you look like SRC is the bad guy in this equation.
I think we have been the bad guys for a long time. Unfortunately, it's because our mandate is not understood. We've been caught severally just to try to let the people know what we actually do, but it's all misunderstood. People imagine that we are the ones doing the negotiations, we are the ones giving instructions. Our role as a commission is really broad-based. And there are so many other CBAs that we have worked with. We've gained no objections, because there is a certain procedure that has been set down just to ensure that everything is in order. And negotiation, we've left it to the union and the employers. Now, if they don't agree between themselves,
but we agreed.
There isn't much SRC can do.
But it looks
if you
like
have agreed, this is what happens.
This
is what happens. This is what happens. The employer comes to the commission SRC and requests, says, we have a CBA that we need to sign. Okay? This is what the union is asking for. Okay? We would like to do the following to the union, to our employees. Can you give us some advice? Are we able, do you think we can be able to do that, or is there some advice you can give us? Because for us, we look across the whole of the public sector. We just don't look at one subsector and make a decision. It becomes unfair.
But when you're doing a CBA, CBAs have, this is not the first CBA to be done in this country. Local government workers have done CBAs for all the time they have existed. But apparently the nurses union, the nurses CBA is being compared to everybody else. For heaven's sake, this is our first CBA.
Okay. And I would want to...
And we journeyed with the employer, and the employer has even written to SRC and explained to them how we arrived at what we arrived at.
Okay, can I cut it down to the chase? SRC, Salaries and Remuneration Commission here is talking about the issue of monies.
Not yet. I haven't even got to